Okay.
Okay.
Hello, Karen.
Hello there, Steph.
I'd like to introduce Karen. She's a therapist at the Institute here, and she works with couples and adults, and has had many years working in fostering and adoption.
Yes.
And is also the person who has written our low-cost clinic booklet. And that's what we're going to talk about today. My name's Steffy Cooke. I'm a psychotherapist, supervisor and trainer, and I work here at the Institute. And I train on the 4-year training course for transactional analysis and psychotherapy. And in year 3, all of our students have a placement in the low-cost clinic. And that's what we're going to talk to you about today.
Yes, the low-cost clinic was the brainchild of Bob
Cooke.
Bob Cooke, your husband, who of course is the owner and the clinical director here at the Manchester Institute.
Since 1987.
For psychotherapy. And Bob first discussed it with me when he had a vision of providing both a service for the community so that people could access psychotherapy who normally wouldn't be able to because of the prohibitive cost of seeing someone who is in private practice.
Yeah.
And also providing his students with a supervised placement.
Yeah.
Because for psychotherapy trainees, there are very few supervised placements available, and often when they are in their 3rd year of 4 years of training, they are ready to see clients, and often they're not yet ready to have actually their own private practice. They need a little bit more practice first of all, where they know that they are being looked after within working with clients. They don't need to be worrying as far as premises are concerned, costs of premises, costs of supervision. What they can really concentrate is doing a really good job and seeing clients.
That's right, you have it in a nutshell. That's exactly right. When Bob set it up, his idea, quite controversial in some ways, I think he also wanted to give something back, because obviously we are a private psychotherapy clinic, and he wanted to give something back to the community. And so when students come into the 3rd year, they have 2 clients to work with for approximately 20 sessions, and they see them weekly for an hour. And the kind of clients that we refer to our students, because by the time they get to the 3rd year, they have been clinically endorsed to see clients, are clients who have been out of work for some time, who financially would not be able to access private psychotherapy and haven't been able to be seen through their GP. Generally, counselling practices for GP services offer between 6 and 12 sessions. So we came up with the idea of 20 because we thought that for our clients that come to the Institute, that would be more realistic, and it would give the trainees the opportunity to really do some good work. So the clients who are on low income, that can't access therapy otherwise, have not been able to access it through the NHS, and they're generally people who have got anxiety issues, or what I would call is not the more serious mental health issues, because we believe that people who are motivated enough to want to come and change and get back to work are more likely to stay in therapy and do the work, and also there's a higher chance of them achieving what they want to achieve. So they're the kinds of clients that we see here in the low-cost clinic. And myself and car and see them twice a year.
That is, we see the trainees twice a
yeah,
year, not the clients. Yeah.
And obviously, for their protection, they come under the umbrella of the institute. So the clients are the institute's clients; they're not the trainees' clients.
And it was really very important to write quite a detailed handbook, because this was new for the institute and new for the trainees. And I believe that the handbook both gives an outline and a foundation for how they will work in the future, as well. And the process starts off for the clients, where they will maybe have seen the low-cost therapy clinic website. They will then phone, book an appointment, and they'll actually be assessed by Bob to ensure that they meet the means test, but more importantly, they're actually matched with a trainee therapist who they will be able to work well with.
But also that they are the kind of clients that can be seen by a trainee psychotherapist.
Yes, yeah.
I mean, that's essential.
So
their work is monitored quite closely, and they will bring issues regarding the clients who remain anonymous to their psychotherapy training, and there's a whole day devoted to such practice, where they talk about such things as diagnosis, treatment planning, and some of the minutiae of what happens in the psychotherapy that sometimes people get stuck on and want some support with.
Absolutely. And of course it's worthwhile saying for people who maybe aren't practitioners that it is common practice throughout the whole of a professional career for everyone always to receive supervision. It's part of our ethical code and code of practice, that no matter how experienced, no matter how long we've been doing this, both Steffy and I supervise other people's work, and in turn our work is supervised too.
Yeah.
This isn't about someone not having many years of experience. This is the beginnings of how they will work for the rest of their professional career.
Absolutely.
That as a vocation and a profession, our work is always supervised by another, to have that other pair of seeing eyes to see what is happening.
Yeah, it's protected professional practice.
Absolutely.
And it's also very ethical.
Yes.
We do this.
Yes.
And of course, the glory of that is that each individual client gets more than one supervisor in the end.
Yes.
Because even though they're gets more than one therapist, should
Yes.
I say? Because even though they are seeing a therapist, their work is so closely supported and monitored that actually they get the best of the best.
Yeah, absolutely.
Attention. So that's good to say. And so after the 20 hours, what happens then is that the clients are the supervisees, the trainees are asked to compile a report on their experience, which again remains anonymous. And this is important because obviously if you are a trainee, you'll know that at the end of 4 years you have to pass an exam, and to do that you have to write a dissertation. So this is good practice because it's a case study.
And I was really interested, both Steffy and I have been involved since the very beginning, since the conception of the low-cost clinic, and I was really interested in how it worked, and if it worked, and the efficacy of it. And so it's now 2 years ago. I began a research project on the low-cost clinic and its effectiveness. And for the prior 2 years, the trainees have asked clients to fill out core forms. And for those that don't know, core forms are the forms that are used within the National Health Service to actually see if services are effective. So they're the forms that we've used, forms that are well used and also recognised professionally. We've had an interesting set of responses, and I'm really pleased with the information that we have gathered to prove the effectiveness of the low-cost clinic. And
so does that look like, because I haven't had a discussion with you about this, does that look like then what you're saying is that it actually has been quite impactful on people?
It certainly has. For those people who have completed all of the forms, then we have had a very, very positive response.
Great.
From their written responses.
Great.
What has been disappointing, and as a researcher, you know, I can get disappointed, is that so often we've had some really good results sort of as we've been going along, and then that final piece of paper hasn't, yes, somebody's decided not to turn up for the final session.
Okay.
So we've got the process looking really good. However, you know, that little bit at the end, yes. So you know, however, you know, that's what real research does. You know, that's the pain as far as real research and real people. And it's also, I think it could be used as a really good learning tool for actually maybe even first or second year trainees to say, this is what happens. Look, you know, we had all these people that came from week 1 to week 18, and then they suddenly felt better, so they didn't come back again.
Yeah.
Which of course does happen in our own private practice as well.
Does,
you know, and that's about the client's process, etc. And it's not a reflection of either the service they receive or the service. So that's been interesting, and I will be discussing the research findings in full, rather than just that sort of quick overview, because there was some really other interesting stuff that's come out.
And there is something else that you need to know as well, is that we are having our own conference. The Manchester Institute for Psychotherapy are running a 2-day conference this year in November, the 23rd and the 24th of November, and that will be held at the Mary Seacole building at Salford University. I think it's called, is it Mary Seacole or Mary Seacole?
I think it's Mary Seacole, yeah.
So do look out on our website to find out how you can actually apply to attend. There'll be some very interesting things go on, including some feedback about our research.
Yes.
And it will be great to see you there.
It will be indeed. Thank you for your time.
Thank you. Bye.